1 year ago, Dixon and Njoroge would have thought he will be undergoing a kidney transplant. It started with insomnia, where he could go for days without sleep, passed less urine every day than before, and had eyesight issues.
I came here, they diagnosed me with kidney failure, and they told me that the only option is dialysis or transplant. Na wakani advise, wakani guide.
Tulikuja kupata akona shida ya figo. After kusumbuka naye sana, tukaulizia tukapata Kenyatta wanafanya hii mambo na transplant. Na ndo nikaamua sasa naweza jitolea nimpe hiyo figo, at least aweze kusurvive kama wengine.
He started with dialysis, which was not easy on him, as it was time-consuming and rendered one unproductive. He later opted for kidney transplant surgery.
There are a lot of complications in dialysis. Yeah. Saa zingine unaenda inakataa, catheter ina block. Unajua sasa catheter bado, it is expensive to put a catheter.
Harvesting the kidney before it is transplanted from the donor to the recipient is now possible through a less invasive procedure called laparoscopy. Laparoscopic surgery is one of its kind now being performed by medics at Kenyatta National Hospital.
Past few weeks, we have joined the world whereby we do very minimal surgery. It's called laparoscopic surgery. We make very, very small incisions on the donor to get the kidney, to harvest the kidney and transplant it to the recipient.
Traditionally, kidney surgery required large incisions with lengthy hospitalization and recovery time. Now, in a laparoscopic surgery, tiny incisions are made on the lower abdomen of the donor. The donor kidney will be removed through several keyhole incisions. A telescope and operating instruments are placed into abdominal cavity using 3 to 4 small incisions. One incision will need to be enlarged to remove the kidney, as the transplant surgeon will be on standby to place the kidney in its recipient.
Nikaelezewa kuhusu hizi types of transplant. Nikaambiwa kuna ingine mpya imekuja inaitwa laparoscopic na kuna ile ya kitambo, lakini after kunielezea nikasema maybe naweza jaribu nikuwe wa kwanza hiyo mpya, juu naambiwa itakuwa easy na itakuwa simple.
The minimally invasive procedure is being touted as a milestone. It has a very short recovery period. Complication rates are very low, and quality of the kidney transplanted is excellent compared to the open surgery.
So cosmetically, it is so good. I'm sure no one would like to have a big scar, okay?
Pain control, it's better in laparoscopy than in open surgery. We talk about need for transfusion, it's less in laparoscopy.
Now Ndekei, as he recovers and plans to resume his life, has to stay on a medication known as immunosuppressants all his life so that the body doesn't reject the new kidney. These drugs are expensive and are not covered by the current NHIF, as his hopes are with the new transition to Social Health Insurance Fund will put into consideration covering pre- and post-transplant medication.
The burden is the cost of medicine. The medicine is very expensive.
The kidney specialists have also urged kidney patients to consider doing transplants, as it's more effective to maintain a transplanted kidney than staying on dialysis, which renders one unproductive at least 2 days of the week when they have to undergo the dialysis sessions. Belden Waliaula, KTN News.